Epilepsy. Disease of the central nervous system which manifests itself by attacks of different intensities ranging from memory loss or absences, petit mal, to serious convulsions accompanied by fainting. In epilepsy, there is a disturbance in brain function detectable in the electroencephalogram, which is accompanied by alterations in behavior or thinking. Classification. What is traditionally called grand mal epilepsy causes generalized convulsive seizures with loss of consciousness. Each attack is often preceded by a sensation, aura, that the patient recognizes, followed by a characteristic cry and falling to the ground. There may be head trauma following a fall or convulsions, and relaxation of the sphincters with emission of urine and stools, as well as ejaculation of semen in men. The patient wakes up in a confused or somewhat dizzy state, or he falls into a seemingly normal sleep that lasts between a few minutes and 2 hours. When he recovered, he complained of muscle pain and a severe headache. At this time, intense bulimia may appear, which pushes him to consume large quantities of liquid or food. Epilepsy called petit mal can manifest itself in several forms: absences or very brief attacks of total unconsciousness, 10 to 30 seconds, without loss of muscle tone, which can go unnoticed by an inexperienced observer. Myoclonic epilepsy is where there is a very brief jerk of the body, or a simultaneous flexion of the trunk and forearm, or an extension movement, shoulders, arms and hands. Atonic or akinetic epilepsy causes fainting from which the affected person recovers quickly. Focal seizures. There are seizures of localized motor movements, one arm, the eyes, etc. There may be alterations of thought, sensory alterations, perceptual alterations, mood and affectivity, etc. Causes. Perhaps half of the cases of epilepsy are the after effects of infections and trauma with brain damage. These cases increase in areas subject to poverty and crowding, due to poor prenatal and natal conditions, malnutrition and even neglect or violence. Epilepsy can also have a hereditary component or appear as a symptom of brain tumors or vascular or metabolic diseases. In young children, it is necessary to control significant rises in fever and particularly sudden falls, almost always due to the use of antithermal medications. This is why, in principle, it is preferable to use hydrotherapy. Sudden changes in body temperature can trigger epileptic seizures. Many anti-epileptic drugs are on the market, some old, others more recent. This allows neurologists to be able to choose the one or those most suited to the particularities of each epileptic patient. Indeed, certain substances are used to treat partial epilepsy, while others are more suitable for generalized epilepsy. In addition, some anti-epileptic drugs can worsen certain types of epilepsy. For example, carbamazepine can worsen generalized epilepsies, particularly in children. Some anti-epileptic drugs, especially older ones, can interact with many other drugs, reducing their effectiveness or increasing their toxicity. Many medications are also likely to unbalance anti-epileptic treatment. For this reason, people who are taking anti-epileptic treatment should not take any new medication without consulting their doctor or pharmacist. Medications that interact with anti-epileptic medications include oral contraceptives, the pill, and certain antibiotics, erythromycin. Anti-epileptic medications often cause side effects: fatigue, drowsiness, weight gain or loss, depression, loss of motor coordination or speech problems, for example. These undesirable effects can interfere with daily life, and the choice of an appropriate treatment takes this dimension of treatment into account. Under no circumstances should anti-epileptic treatment, however effective it may be to the detriment of the patient's quality of life. If bothersome side effects occur, you must report them to your doctor and under no circumstances interrupt or modify your anti-epileptic treatment without his or her advice. The substances prescribed in the treatment of epilepsy in adults or children are numerous. The oldest anti-epileptic drugs have been on the market for more than 30 years. The choice of anti-epileptic medication depends on the type of epilepsy to be treated. The effectiveness and side effects of an anti-epileptic drug can vary from one person to another. Newer anti-epileptic drugs are usually safe, but all can have side effects. Minor side effects are common. Certain substances expose you to allergic skin reactions. which are unpredictable but potentially serious. These include lamotrigine, oxcarbazepine, zonisamide. In the event of redness or pimples on the skin without an obvious cause, conjunctivitis. Sore throat or fever, notify your doctor immediately. Treatment of seizures. It is important to protect the head against blows, the tongue against bites by putting a tissue between the teeth, and to keep any dangerous object away from the patient's reach. It is necessary to consult the neurologist for the correct diagnosis of the ailment, the cause, if any, and to prevent future attacks. Dietary treatment. Deficiency in group B vitamins and certain minerals. Stress. Fatigue. Fever and consumption of alcoholic beverages are the factors that most frequently trigger attacks. Alkalizing diet. The alkalizing diet is based on fruits, vegetables, salads, potatoes and skimmed milk. It can be soy, oat, or rice. Ingestion of bicarbonate reinforces alkalization. You should take plenty of fluids. Plant-based food is the most appropriate. Completely eliminate toxins such as alcohol, tobacco, coffee, and drugs. Avoid diets high in fat and low in carbohydrates, as they have an acidifying effect in the body. Avoid constipation, which can promote the appearance of a convulsive attack. Physical treatment. Follow a healthy lifestyle with regular habits. Sleep the necessary hours. Air and light are essential, which is why it is advisable to work in the open air if possible. Avoid abrupt physical exercises and sports that involve high risks, such as swimming or mountaineering, due to the possibility of suffering an attack during their practice. Psychological treatment. The patient must not feel alone or marginalized from a social point of view. Social contacts and contacts with friends are essential for him. He must be kept informed of the psychological process which can lead to the repetition of attacks. Psychotherapy must also take into account that some epileptics use their illness to attract the attention of those around them or to escape difficult or inconvenient living conditions. Under no circumstances should they be allowed to drive cars or motorcycles or handle dangerous tools. Medicine. Head bath. We use an infusion prepared at the base of the cypress. 20 to 30 grams of green cypress nuts, fruits, crushed, per liter of water. Boil for 10 minutes and filter. After the bath, take a pile of chili leaves and castor nuts, apply it directly to the scalp. Porridge of millet, in which one adds a spoon of blue band. This is taken after eating 2 oranges.